Hi, everyone. This is Brad Peroni from Carnegie Science Center. I am the Director of Public and Community Programming, and welcome to tonight's webinar. We have assembled a panel to talk about the effects that many people might be wondering about from the aftermath of the train derailment in East Palestine, Ohio. I'm sure we have folks from Ohio, West Virginia, Pennsylvania joining us here, and maybe even further afield. We have received over 100 advanced questions that will help to guide our discussion here tonight. And you'll also see the Q&A button at the bottom of your Zoom window. You're welcome to add some questions to the window, but with the sheer number that we've been asked, we just mathematically can't get to them all. But we'll try and get to most of the questions that have come up repeatedly. Before we introduce our panel this evening, I would like to reassure everyone, let everyone know that the panel we have assembled has no affiliation with any of the parties involved in the train derailment, the cleanup, or any of the agencies involved with regulating or overseeing that effort, nor any financial stakes in any of those companies. So these panelists are all independent voices who we have recruited from the University of Pittsburgh. So we should have a very informative conversation tonight, and I can't wait to hear what everyone says. So I'm going to introduce each panelist by name and ask them to take 30 seconds or so to talk briefly about their areas of expertise and their work, and then we will get into the conversation informed by all of your questions. And we'll go in order that I see you on my screen. So first, I would like to introduce Dr. Juliane Beier.
Hi, so I am an assistant professor of medicine, and I'm also and in the division of gastroenterology, hepatology, and nutrition. I'm also a member of the Pittsburgh Liver Research Center, and I hold a secondary appointment in the Department of Environmental and Occupational Health. I study liver diseases and how low-level concentrations of environmental chemicals, specifically vinyl chloride, can enhance underlying liver disease and lead to, enhanced disease states, including tumorigenesis.
Great. Thank you very much. And next we have Dr. Peng Gao.
Good evening, everyone. My name is Peng Gao. I am an assistant professor in the Department of Environmental and Occupational Health at the University of Pittsburgh School of Public Health. I also hold a secondary appointment at the Department of Civil and Environmental Engineering at our School of Engineering. I am an analytical chemist and exposure scientist training both biomedical and environmental science. My lab research majorly focus on the determination of different type of environmental contaminants in environmental samples, as well as xenobiotics in biological samples by using cutting-edge mass spec spectrometry. And the ultimate goal is to investigate how these chemical stressors can contribute to human non-genetic disease and chronic disease.
Thank you very much. And we have Dr. James Fabisiak.
Hey, my name is Jim Fabisiak. I'm an associate professor of environmental and occupational health at the School of Public Health at the University of Pittsburgh. And I'm also the director for our Center for Healthy Environments and Communities. So I would characterize myself as a toxicologist and environmental health scientist, and probably the sort of most recent things that I've been spending time studying are issues of air pollution, so especially as they relate to sort of the issues and affairs that go on in Southwest Pennsylvania, Pittsburgh, and also trying to sort of consider a sort of broad breadth of environmental health topics as they relate to Southwest Pennsylvania in particular.
Thank you very much. So as we get started with our conversation here, I would like to acknowledge, first of all, with the over 100 questions that have come in, we are going to do our best to stick to the areas that our panel tonight can best speak to. So some of those questions might be better served with some other experts. So if you don't hear your question being asked tonight, it's not that it's not important, but we are really going to try and stick to the topics that we can best serve with the panel that we have here this evening. So I had a chance to look at all these questions coming in, and there were some obvious themes that came up over and over again. A lot of people were asking about air quality, their drinking water, health impacts from the aftermath of the derailment, both now and in the future. And one of the other biggest things that people ask about is, what about where I live? So, this is a question that I would like to put out to any of the panelists here to answer from your own perspectives, whether it's, air quality, water, health concerns. If we think geographically, how far away from East Palestine do we think we should be feeling pretty comfortable about our situation? So let's start first with the positive. Where, like, as far out here as Pittsburgh, or where do we think that we might be pretty much in the clear from a lot of the effects of this?
If you want me to start off with that.
Yeah, why don't you go ahead and start off?
Sure. So I would feel very comfortable that the Pittsburgh region itself has felt very little impact as the result of any of this. I mean, I can think of nothing that I do any differently in the course of my day, take any extra precautionary measures. I drink the water, I shower here in Pittsburgh. I feel that that distance and the concentrations of anything that would make their way this far would really be negligible. There was perhaps a plume of particulate matter pollution that occurred during the very, very early stage of the sort of controlled burn that may have been detected on air monitors, but even that, the concentrations would be very minimal by the time they reach here, have very little impact, and occur over a very, very short time. Those things that remain in East Palestine are clearly problems for East Palestine, but certainly have minimal effect here.
Okay. So, and then let's talk about East Palestine itself. It's hard to put an exact figure on it, but if we think about the folks in East Palestine and the directly adjacent areas within about 10 miles, for the folks living in that area, what sort of issues should we be looking at right now as far as air or water are concerned, very, very close to East Palestine? Peng or Jim, maybe one of you want to weigh in this, or Juliane, feel free to jump in on that one too. But the air and water quality very close to the site.
Yes. So in general, I think there is no a magic number in terms of the distance. What I can say is just if you are closer to the accident site, you got higher health risk to be impacted by the accident. Like Jim said, I think Pittsburgh is too far away to be considered about the health impact. And the thing that we really need to know is about the concentration of the possible contaminants that have been released in the environmental metrics during this accident, especially like air, because the chemical will get really diluted if they travel away. And some of the chemical of concerns during the accident are really have really short half-life, so they are not persistent in the air. The thing that we are more worried about right now is the more persistent chemicals that may be produced. I just say may be produced during the burn off, etc. So in general, based on the confirmed released chemical by EPA right now, I think their concentration should not be worried about too much. But if we are really, really close to the accident site, I mean, definitely you want to get some monitoring data and some sampling to confirm the health risk. Yeah.
Great. And you mentioned half-life and in regards to the air quality and compounds that may be released into the air. Can you just explain very briefly the concept of half-life for anyone in the audience who might not be familiar with that? Yeah,
so I think everyone can easily Google the half-life of the chemical that you have concern. The half-life means that they will provide you a value of time. So that time means that the time that this type of chemical get to half of this concentration. For example, if in the beginning it's 100 ppm, and then when it get to 50 ppm, it takes 2 days. Then the half-life is 2 days of this chemical. And it really depends on the chemical itself. Also, it depends on the metrics, the environmental metrics we are talking about. Also, many other environmental factors may impact, like the sunlight because of some photochemistry reaction. Also, the microbial community on the site, because some of them are able to degrade certain type of contaminants. So it's really case by case. Yeah.
Great. Juliane, I would like to ask you, specifically in the area around East Palestine, close to the accident site, we've received a lot of questions regarding the vinyl chloride that was, involved in this, and the risk of liver cancer related to that long term for the folks who live there. I was wondering if you might be able to give us some of your insights on what might be some longer term impacts close to the accident site.
So one of the things that we know about vinyl chloride is that at high concentrations, aside from the acute effects that it can have, it is a group A human carcinogen. This would be high concentrations for a long period of time. But one of the things that we have recently also studied in our laboratory, and this is not in humans, these are preclinical models, that low concentrations of vinyl chloride can enhance several stages of liver disease, including tumorigenesis. So yes, so what I'm saying is that these low level concentrations, we don't know if they are actually persisting in the area of East Palestine. However, we have shown that low concentrations could potentially do this. So this is something that we will have to monitor and look for to see if there are any contaminations of any of the sort.
And so this is an ongoing area, an area of ongoing research, and we're learning more about it. Let's think about that in terms of the half-life concept that Peng just mentioned. How long, if it's not removed from the environment, could vinyl chloride potentially linger in soils or water? And that can be for any of the panelists there, but I think especially maybe for Juliane.
So in the outdoor air, we don't have to worry about this anymore. So we talked about this, it has dissipated. I don't think we have to worry about vinyl chloride specifically in open body water, because that's a similar situation like in air. There's sunlight that will break it down and it'll dilute. Similarly, the soil, although that's a little bit more of a tricky question, and I am not 100% sure of the answer on that, but I think soil is also less of a concern in terms of vinyl chloride. One of the concerns that we have are that low-level vinyl chloride concentrations could reach the groundwater and therefore get distributed to potentially private wells or homes that are located above aquifer, a relatively high aquifer. And so from there, since vinyl chloride is highly volatile, it can suffuse within those zones. So it can come out of the water, especially at room temperatures, even at low concentrations. The problem with vinyl chloride is that it is relatively stable in in the groundwater because there is no sunlight and there is no air.
So that's potentially where it could linger the longest.
So I am not saying that anybody is unsafe at this time. I just, with the data that we have at hand, we cannot say how safe we really are. We need to know numbers and we need to continue monitoring.
And if I could speak to the sort of complexity that you were sort of talking about before, which is in terms of how chemicals move around in the environment, for example. So, you know, I don't think that you can think of this situation, especially if we're considering a pool of chemicals that have been spilled into the soil and then migrate over time, depending on how the water runs, that they will not diffuse in a very sort of simple radius from that point. I think the geography and the hydrology has to be considered into what's going on here. And so I had a chance to visit East Palestine last week. And one of the things that I had sort of noted was that there's a small stream that runs east to west through East Palestine that runs very close to the site of the derailment and then enters a larger stream that basically heads north and south. And so I would anticipate that any chemicals, whether they be vinyl chloride or any of the other things that have spilled, have the potential to move through the soil, move through the ground. If they encounter either those streams or groundwater, they are going to go in the direction that that groundwater or that stream is running. So, you know, I don't think it's a simple diffusion from a circle when we're thinking about ground plumes or water contamination.
Great.
I can add some on that topic.
Please.
Yeah, usually it's the soil organic matter in the soil and the sediment that have the ability to retain or absorb these organic solvent or contaminants. So if they are already absorbed by those soil or sediment substrates, then it will become pretty stable and less bioavailable. But if you have some interrupt, like if you throw a stone into the river, you might see some rainbow as a reason because some organic solvent released from this element. Yeah, so that's hard to say that the human health risk in terms of that because they are staying there. So I would definitely recommend the resident at East Palestine avoid to touch or get close to those small rivers, which may have higher concentration compared with the large pond, etc. And other thing is that we have to know that vinyl chloride is a confirmed carcinogen. So that's probably the reason why they choose to burn off in the beginning. So the risk is hard to tell if we don't have the concentration level in the samples. We have to do the risk comprehensive carcinogenic health risk assessment based on the levels, and then we can tell the residents and community how high is the health risk and what kind of risk level is acceptable. Yeah.
Great. So we established that here in Pittsburgh, probably not so much to worry about with the impacts. Close to East Palestine, you know, definitely cause for concern and monitoring needs to continue. But then we get into a gray area between these two destinations. So folks in Beaver County, Butler County, the northern panhandle of West Virginia, what might you say to the folks in this in-between area about the type of, you know, testing that might be needed to tell how far this impact is going to be felt from East Palestine? You know, is this going to be, you know, we need to take some test water in, you know, Butler or Monaca? Do we need to take soil samples? How will we be able to figure out how far these, you know, contaminants might be impacting folks?
It's one of the easiest things to sort of do first would be to sort of ask yourself whether or not you have well water or whether you have a municipal source of water. And we're talking in this sort of intermediate kind of distance, right?
Mhm.
I mean, I'm thinking if you're in the sort of intermediate distance and on municipal water, there's probably an awareness for those municipal water companies to be testing the water for what might potentially be in there that's relevant to East Palestine. And if you have a question or you wonder, I think you could probably call your municipal water company and find out exactly what it is that they're doing. If you indeed have a private well, which are far less subject to regulation than municipal water supplies, then by all means, I think that you should have your water tested, whether it be through a free available program that might be offered, depending if you're in Ohio, in Pennsylvania. It might depend on who the relevant sort of authority might be to do that. Have your water tested, and then you might have a little bit better idea about whether there's something in there, or at least it's safe. If you're even a little bit closer, then I might even consider routine testing or some sort of testing over time that keeps track of your well. I mean, if you're 2 or 3 miles away from East Palestine and have a well, testing it once right now may come back totally negative. But if we're talking about the way these chemicals can move around in the ground over time, and all of the different chemicals may again move at different rates. So I think that it would be good to have some sort of routine testing of well water over time, just to give people peace of mind and to catch something early if something has happened.
Great. And another question that came up frequently was, is there anything that I can do at home? Do I need to invest in some kind of water filtration system? Can I use a commercially available water filter that uses carbon? And I know, Juliane, we were talking a little bit about this before we started here. Can you speak a little bit about that type of carbon filtration that we might see in the pitcher you keep in your fridge?
Yeah, that's a good question. And yes, we definitely can do things about this. So getting one of those activated carbon filters, pitcher type things, or under the sink situations, that's a good start. They filter out a lot of chemicals. And the only thing is you need to keep your filter changed. I mean, you need to keep it fresh at all times. However, the activated carbon becomes a little more tricky on certain chemicals. So it can absorb a wide area of chemicals, including VOCs, volatile organic compounds, which vinyl chloride is one. However, it is less effective for compounds that have small diameters and that are highly volatile, like vinyl chloride. So vinyl chloride does not absorb very well to that activated carbon. And an additional factor is that these water filter pitcher, these pitcher type water filters also are wet, obviously, because it's in the water. And that diminishes the ability of activated carbon to absorb some of these chemicals like vinyl chloride a little more. There are some other commercially available filters, like the reverse osmosis filter. I think people have talked about it. That would be potentially worth an investment. However, we are talking with vinyl chloride specifically, we're talking about very low concentrations at this point. So I'm not sure if that is at the moment worth the investment. As I said, with the carbon filters that we can buy right now, we can probably already do remediate the situation.
Okay, thank you. So as we've said, we've got this intermediate gray area where we don't have enough data to say for sure geographically, are we here, are we there? But as we've been hearing from our panel, mostly folks with private wells are the ones who might want to take those steps of testing and, potentially testing frequently, depending on how close you are to East Palestine and that border region.
And I would add that that's data that can be gotten over time. I mean, people can take soil samples that increasing distances away from East Palestine to see if there was anything from the smoke that deposited, for example. And then you would have some data to be able to sort of know what that gray area is really like.
And do we know if there is anyone who might be planning to do that now, just from conversations you've had, in the weeks since this has happened? Does anyone on the panel know of anyone who's planning to undertake that task?
What kind of task you?
Maybe some soil sampling, out from East Palestine.
Yeah, we are working on that. The point is to find the grants that can cover the expense as well as the personnel that can go there. But we are really interested and working on that to do some environmental sampling. Yeah.
Great. So hopefully we'll see something come out of your lab, and
I guess I would also add that at least in these early stages, that those first responding agencies, such as the EPA or the Ohio DEP, or whatever the equivalent would be, their immediate focus, and rightly so, should be on the people of East Palestine. And everything takes time, money, and resources or whatever. So I think it behooves them to get the best picture they possibly can for the immediate vicinity of that community. And then as time allows, or additional resources, whatever, begin to move out and see what the risk is. But certainly you want to accomplish all of this in as timely a fashion as possible.
Thank you. Another theme that has come up in many of the questions, specifically, folks are, wondering if this is going to affect children differently than adults who are actively developing and growing. Is there anything that we should be thinking about, especially for the folks around East Palestine, more so than out as far as Pittsburgh?
That's a tough question. I think we can never assume that children are little adults. So of course, children are always handled differently, but at this time, I don't know if we have enough data to really answer that question. I know this is frustrating, but I think this is where we are at right now.
I mean, I think we have plenty of reasons to sort of believe that children would be more sensitive to almost any type of environmental contamination regarding, whatever chemical. They drink more per body weight and they breathe more per body weight. So at whatever concentration is in the atmosphere, they are likely receiving a greater dose. They are smaller, so it does not take as much absolute dose of a chemical. They spend time playing in the dirt. They are closer to the ground. So there are several factors that would sort of make them vulnerable in almost any type of environmental contamination scenario. So nothing specific for East Palestine, but one should always take special care with children.
Correct. I concur. Also, the elderly can be another sensitive and vulnerable group as well. Because during the exposure risk assessments, usually we will use more conservative factors to calculate the acceptable level for children or elderly compared with adults. So the acceptable level are usually higher than adults. Yeah. So no matter what kind of chemical stressor you are talking about, it's always the case. Yeah, they are more sensitive.
Yeah, that is a great thing to keep in mind too. And I want to call out one thing that we're seeing that come up a few times in the Q&A, button that we have at the bottom of our screen here. We have some folks who want to correct us on the pronunciation. So folks living there call it East Palestine, not East Palestine. So we hear you, and we can adjust that. And, you know, another question, another theme that has presented itself a lot is the food that we eat. And specifically, a lot of people are wondering if they should plant a garden this spring. You know, is the fruit or vegetables that they grow going to be safe? And the answer that we might have here is we don't know, but do we have any thoughts? Let's say if someone had been living close and saw a lot of soot from this blaze, you know, falling down on their property, do we have any thoughts about that?
Well, there's one standard precaution that can often be taken, and this is even advice that's given to people who desire to have a garden in an urban situation that may have the soil contaminated from a legacy of pollution. And that is sort of using a raised bed approach to sort of get some timbers or wood, or, you know, make a sort of bed and bring in new fresh soil that is raised above the ground that you can grow your vegetables, et cetera, in. So at least you know that that soil that you are using isn't contaminated. And if you're confident that the water you are irrigating the garden with, and hopefully it's maybe just simply rainwater that you can collect, is also going to be relatively free from pollution. So I think that's at least one preventive mitigating strategy that can help people still enjoy the fact of having a garden and avoid having it extract what might be contaminants out of the ground.
I think that's great advice. And, you know, I would also echo that if you're not sure, maybe it's best to skip it for a year or two. If you don't feel like you can build that raised bed, maybe go to the farmer's market and buy something that was grown a little bit farther away. Great, thank you. That is good advice. So we have, you know, another question that has come up a lot, and I want to say, you know, more than 10% of the questions that that came in mentioned pets in some way or another. And just as we should assume that children are not tiny adults, we should not assume that pets are tiny people. And they're, you know, walking around on the ground outside. If you're, you know, have a dog that goes out and licking, is there any different advice or concerns that we should have for the furrier members of our family?
As we mentioned, because pets definitely are more sensitive and vulnerable compared with adult humans. So I definitely recommend the family who has pets take extra care of their pets, especially don't let them swim in the river and drink the river water, and play around on the contaminated soils, etc. So to reduce the exposure risk of their pets. Yeah, that's my suggestion.
I'd like to add to that one of the first points that we were making. This is again depending a little bit on the distance, of course. What Dr. Gao was just saying certainly is, you know, very important for the areas close by, close to East Palestine, in East Palestine and close to it. However, I think this question also came from people that live in Pittsburgh, and I think we need to be less worried about that in Pittsburgh.
Yes, I'm talking about the East Palestine resident. Yeah.
And I think I'm also a proponent of the fact that our companion animals in many ways can act as sentinels for the environment. So for the same reasons we talked about, that children can be more sensitive, domestic animals can. They're smaller, they breathe more, they lick themselves, they groom themselves, they're outside playing in the dirt. And I would say, if you have questions about your animal's health, that you have serious conversations with your veterinarians, whoever is providing health care to your pets. Try to get them on the same page and consider, what might be a toxicological exposure that results in some of these. Actually, veterinarians are probably more familiar with toxic exposures in animals than human physicians are in many cases, because animals are always getting into stuff in the barn or whatever. So there's actually probably a larger clinical base of knowledge in the veterinary field. And so I think that, animals that are sick can have samples taken. If they succumb, they can be necropsied to find out what the cause of death was. That might give some very good clues as to what may or may not be an environmental contaminant associated with that particular case.
Yes, also the biological response to the same chemical can be different compared with human and animal as well. And also the symptom can be different. Really depends on the exposure and the type of the animal. Yeah.
Great. Thank you for that. That is, again, sound advice. And let's move a little bit more into some chemistry, and let's talk a little bit more about vinyl chloride. We have one question that has come up a number of times about the safety data sheet. The safety specifications for vinyl chloride have been changed recently, and folks want to know more about that. Why a change might happen to, vinyl chloride, if it's such a, potent carcinogen, why might the, exposure guidelines, be modified? So maybe Juliane or Peng, do you have any thoughts on that? Safety recommendations specifically?
I'll start if you don't mind.
Yeah.
So all chemicals are being evaluated on a regular basis. It depends a little bit on the research that is being done. So one of the questions that I know always came up was, why was the last evaluation of vinyl chloride so long ago and then only came out this year? There was not a lot of research being done on vinyl chloride, so there were not a lot of data to reevaluate. But all the chemicals that are currently known are being evaluated, and like fact sheets are being put together. And, it just happened to be the time that it was, vinyl chloride was reevaluated. I think it's pretty public knowledge. Well, it's public knowledge that I was a reviewer of this particular report. That means I did not write it. I just, reviewed it for accuracy. And the review that we conducted was over a year ago. So I did this in January of 2022 and submitted it at the end of the month. And then it just took a while to be re-reviewed by, the officials and then be published.
The government never does anything fast.
A glacial pace for sure. So it just happens to be a timing issue where we're seeing this, even though that work had been done previous to 2022. You were reviewing the work that had been done, before that even. So this is, a change that has been in the works for years now at this point. Is what we're hearing.
And it's typically done. I mean, we're sort of going through the process of reviewing the health-based literature that allows us to decide whether we should lower the PM 2.5 standard. I mean, so routinely these regulations, these guidelines or whatever, get revisited as new data accumulates. I mean,
yeah, there is another thing I want to feature is that for the carcinogen like vinyl chloride, in series, there is no safety dose. So it's the same thing applied to alcohol drinking and smoking, right? Because they are carcinogen, but there can have a acceptable level based on the risk assessment calculations. Similar to some other contaminants like lead. Ideally, we definitely want them to be zero in drinking water. And PFAS right now, EPA set a really trace level for these contaminants. So that's only based on the technical side, because the water treatment factory, they cannot achieve to zero. And the agencies think that kind of trace level is acceptable in terms of the carcinogenic effect. However, if we are talking about the acute toxin like butyl acrylate, for example, definitely if the concentration in the environmental samples are lower than the threshold levels, they are totally safe in terms of that single chemical. Yeah.
Great. And another chemical that we have received more than one question about was dioxin that might be produced as a result of the burning that happened back in the beginning of this. So would anybody like to talk just a little bit about what dioxin is and what that might what folks might need to be concerned about as far as that's concerned in the East Palestine region?
Maybe I can talk about that. Yeah.
Great.
So dioxin is another group of carcinogens. Also, it belongs to POPs, persistent organic pollutants. So it has been studied for a long time. Usually, it produced by the incomplete combustion. You can easily detect them in the solid waste treatment plants if they burn the solid waste. So on East Palestine's accident, when the agency burned off the vinyl chloride, there might be some other organic chemicals, organic matters, etc., present on site. So when they have the incomplete combustion procedures, they have a chance to produce dioxin and some other known or unknown toxins or carcinogens as well. But it's just based on the possibility, because if most of the reaction are complete combustion, they will convert into water, carbon dioxide, or hydrogen chloride, which don't have too much to worry about. Yeah. Right now we have really limited data on these possible byproducts, combustion byproducts. So definitely want to push the agency to monitor more of these chemicals. Yeah.
Great, thank you.
And again, I think we've reinforced this a couple of times, but it's sort of that proximity to East Palestine that's liable to be the most important factor here. I mean, if there were visible large amounts of ash that fell on your property, until we know what's in that ash, you might be cautious about having a garden or something like that. If it's this gray area where you haven't seen any ash fall down, et cetera, then maybe you sort of have to have a little bit more of a guessing game. But if there's visible ash contamination and not knowing what is in that ash, it would bear agencies to look at what it is.
Mm-hmm. And let's think about ash or soil or water. Peng, you mentioned in your introduction using mass spectroscopy to analyze samples. Can you just tell us briefly what happens to samples whenever they're taken in? How do we figure out what's in those samples?
Usually in most of the test lab, they will use GC or LC mass spec, which the full name is liquid chromatography or gas chromatography, coupled with mass spectrometry. And if we are talking about target analysis, if you have some certain chemical that you have concern or interesting to analyze, they will just use the conventional low resolution mass spectrometry to do the analysis. And the way to choose LC or GC depends on the chemical of interest. Usually GC are more suitable to analyze the volatile and non-polar chemicals. It's hard to explain in layman language, but it depends. It's related to the chemical property of the contaminant you are interested in. Also, so for the LC, they are more suitable for the non-polar and polar and the non-volatile chemicals. Yeah.
But we do have the ability to look broadly or narrowly to try and identify a particular contaminant that we might be trying to identify.
Correct. In the professional lab, we are able to identify and quantify the chemical of interest in these samples.
Great.
And I think that's an important factor to sort of think about here, because it's possible that some of the homes or whatever are being screened in East Palestine with simply trying to get a measure of total VOCs. Okay, I mean, and that is something that can be done pretty quickly. You can essentially do that with a machine, spend 10, 20 minutes in a house, and you'll get a number for that. But it's important to realize that there are many compounds that qualify as total VOCs, many that don't have anything to do with this particular derailment. I often think that is sometimes like counting birds when you are trying to count the number of parakeets. Imagine that you had a train car that had a wreck and released a load of parakeets into the environment. And you want to know how many parakeets are out there, but you go and count how many birds you see. And it's really not the most accurate way to get a handle on what specific chemicals are there. Now, if that's a great screening method. It gives you certainly a good first pass, but it really needs to be followed up with what are those specific chemicals that are in the air, and if any of those relate specifically to the accident or incident.
Yes, so the total VOC, I think it's not that reliable because as Jim mentioned, it's a really large group. It contains at least thousands of chemicals. Also, usually based on my experience, such quick tests of the total VOC, their detection limit of the device is really high. So it cannot tell you the trace level of certain chemical, especially for carcinogens. If you have really trace level, it might have some health risk. Yeah.
Great. Thank you. I want to point out that it is 7:51 and we are going to wrap up at 8 o'clock here because we know that our panel is very busy and they've been taking many calls and fielding many questions about this situation. And we're going to get a few more questions in, and then we're going to give each of our panelists a chance to have some time to have the floor and give some closing thoughts before we do wrap up. So thinking more about the water, we've been talking a lot about the groundwater, and that's and the private wells, and we're not sure exactly how long it would take to infiltrate through the aquifer and make it to any individual's well at any distance away. Does anyone here know if there's any way that we can remediate pollution down in groundwater? And that's if that's outside of your expertise, that's no problem. But is this something that we could dig a well and pump out a lot of water in a contaminated area, or is this something that takes more effort than that?
There are many different type of remediation approach. Usually there are three categories of physical, chemical, and biological. Physical is pretty simple. You just move all the contaminant water or soil away and put them into hazardous solid waste, landfill, etc., or just burn them in the professional facility. Chemical is that usually they will use some solvent that can extract the contaminants and like doing some soil flushing or soil washing, and then collect the solvent so it can be disposed properly. Biological is the most ideal one, but it's the slowest one. So there are certain type microbes, as I mentioned, or the plant can do the phytoremediation. So either the plants or the microbes they can put on the site, and they can degrade the contaminants. I think US EPA have a lot of experience on that because they are remediating all the Superfund sites across the US. Yeah.
Great. And I'm looking into the questions that were submitted in the box down below here. And there are some questions about other chemicals. Vinyl chloride seems to be the big headline chemical that a lot of people are talking about. But there's, it's a whole mixture of contaminants that we have to think about here. So, some of the other chemicals that I'm hearing and seeing, called out by name, butyl acrylate, ethyl hexyl acrylate, ethylene glycol, monobutyl ether. Are there other chemicals aside from vinyl chloride that we should be concerned about, either for our health as far as it relates to cancer risks or contaminating our drinking waters?
Oh, I think the chemical that you mentioned are all confirmed by EPA, that they confirm they are released. So definitely I would recommend to test those chemical if you are using private well water. And for the unknown, it's really tricky. I mean, because without the data, I cannot tell you it's presenting the East Palestine's environmental metrics or not. But if you are interested, definitely you should include them as well to make sure it's safer compared with just testing the confirmed chemicals. And again, I would recommend the community resident to know the risk of acute toxin and carcinogen. They are totally different. One is more acute, the other is more chronic effect. So you have to know what chemical belongs to when you consider those health risks. Yeah.
Thank you. So I will turn it over to each of our guests here to take a moment to have some closing remarks. Before I do that, I want to thank everyone for joining us tonight. I know that we very, likely statistically, we're not able to get to your specific question, but we tried to take all of that into the inspiration for this conversation tonight. And we hope that we were able to answer your questions. Hopefully we were able to have some folks walk away feeling reassured based on their location, that they are relatively safe, and hopefully provide some clarification to folks living closer to East Palestine, more about the science of what's happening here. But again, I'll go in the order that I see the panelists on my screen. So Juliane, let's start with you. Take a moment or two for some closing thoughts.
I think, honestly, we touched most of the important points that I wanted to make. Again, I want to say first of all, I'm not a physician, but and I want to say that none of these people are necessarily unsafe. I think I want them to be aware of that. I would like to urge everybody to encourage everybody to just continue have their water and potentially indoor air tested, just to alleviate any concerns. And that is honestly really most of it. If you have any concerns about your current health, talk to your physician about it, and have yourself monitored if possible. Just this is only if you're concerned. Again, I'm not saying that anybody is necessarily unsafe.
Thank you. Peng, any closing remarks from you?
Sure. Yes, as Julian said, I know it's really frustrating to tell you an uncertainty answer because we are all scientists. We cannot make conclusion without data and the result. So we can only provide you the potential risk information regarding what happened. So that's my thought. When we have more result in terms of the monitoring sampling, probably we can give the community more confident answers. And besides the chemical analysis I have talked about a lot, I think there are some possible feasible ways that we can reduce possible exposures, like don't drink the private well because they are not monitored, and reduce your shower time if you have concern of the water contamination, and don't let your pets and children play close to the contaminated water or soil. And we have mentioned that. So, and also maybe use the water filters and the air filters at your home, trying to reduce some possible exposure as well. That's all the things that we can do at this time before we confirm the levels of all the chemical of concern that we have at East Palestine. Yeah.
Can I add one more point to that? And Peng raised a few very good points. One of the things that I've been saying in all of my conversations recently was air out your homes. If this, of course, is if outdoor air has been monitored and deemed safe, but air out those homes on pretty days like today. Just get some fresh air and make sure everything is nicely ventilated.
Wonderful. Great. Jim?
Okay, I'm just going to change the subject a little bit. We've been spending a lot of time talking about sort of the problems of, toxicity and all of this sort of science stuff, and especially to sort of those people who are in Pittsburgh who are sort of concerned about that. And I, as a Pittsburgher, am spending more time thinking about the amount of rail traffic that goes through Pittsburgh, the potential for something like this to happen here in such a highly populated, dense area. Are we prepared for a similar first response scenario? Can we effectively evacuate a population in 1 mile radius of where something like this happens? I prefer to call these types of things incidents rather than accidents. Accidents imply it's basically an act of God of which there's sort of no control over, but an incident has some element of human error or human behavior or something that could be done to sort of prevent these things from happening in the first place. So I think you could probably arrange a whole nother conversation about what sort of transportation, first response, public health initiatives could go towards mitigating something like this happening in other places, or even, specifically locally. How well is Pittsburgh prepared to deal with something like this?
Yeah, and that is a sobering thought. We certainly haven't been tested in that regard here, at least not in my lifetime. So I, hope that, it doesn't come to that, but we have a lot of rail here in town. So it's certainly something to think about.
And there have been derailments. Luckily, they didn't involve hazardous substances.
Yeah. So and we see statistics. There are at least 4 derailments across the country every day, but they don't always, and I would even go as far as say extremely rarely, end up with a situation like we've seen here locally. This is the exception and not the rule. So if you hear about other train derailments, that doesn't necessarily mean that the same thing is happening in other places. This was unique set of circumstances. So I would like to thank our panelists for joining us tonight. I really appreciate you taking your time, as I know our audience does as well. And I want to thank everyone who joined us here, tuning in this evening. We appreciate you coming here and hoping that we've answered some of your questions. If you know someone who wanted to see this but didn't get a chance, we have recorded it, and we will be posting that video onto our YouTube channel, so you can see that in the near future. That's YouTube at Carnegie Science. So thanks again to everyone. I will hopefully not have a reason to call you back for another one of these anytime in the future. Hopefully we won't see another incident like this happening, but I do appreciate your expertise and taking the time to talk with us tonight.
Okay, thanks. Glad to be here.
Thank you.
For having us.
Thank you.